Welcome back to Curious Conversations. Our guest today is the eminent Dr. Kathryn Martinez. Hi, Dr. Martinez. How are you doing today?
Good, how are you?
Doing great. So, Dr. Martinez, today we'll be talking about a new observational study that you published in Cureus, Physician Gender and its Association with Patient Satisfaction and Visit Length, an observational study in telemedicine. So, before we jump into this, could you tell us a little bit about your background?
Yeah, so I have a PhD in health services research, and I'm currently an assistant professor at Cleveland Clinic Lerner College of Medicine, and I'm a core investigator at Cleveland Clinic's Center for Value-Based Care Research.
Awesome. So our subject today is about telemedicine, especially in regards to physician gender. So what really sparked your interest in this area?
Well, interesting. Sometimes you just get lucky with some data sets. And a few years ago, a giant data set sort of fell in my lap. And it was this nationwide direct-to-consumer telemedicine data set. And I had all the data for the whole country for 2 years on this telemedicine service. So this presented opportunity to study a lot of different things. I had all of the patient visit reasons, all the diagnoses, all the drugs, everything. And so we mined this data and we published a few papers out of it. So one of the first ones we looked at was patient satisfaction in antibiotic prescribing. We also looked at antibiotic prescribing and visit length. And so we had sort of tackled this question in pieces before, but then this big paper came out, I think it was in 2019, that showed that female physicians are directly impacted in their wages by having longer visits with patients. So we saw in our data an opportunity to sort of explore this more. One of the big advantages that we have in this data set is because it's telemedicine, we can measure visit length exactly. So typically when you do studies of visit length, you would be measuring visit length by a nurse, somebody that's checking in when the physician went in and out of the room. With this, we can measure it down to the second. We also had a ton of data, 120,000 patients. So it was a really great opportunity to pursue this question.
Fascinating. So now that we got a little bit of the background, let's actually take a step back and for our viewers, could you explain what exactly telemedicine is?
So telemedicine is a lot of different things. So telemedicine could be, using even calling your doctor on the phone. For this type of telemedicine, this is called direct-to-consumer telemedicine. So it's not associated with a particular health plan or health institution. This is the sort of thing like Teladoc or American Well or Doctor on Demand that anybody can call for a flat fee and seek care for generally low acuity conditions. So we've done studies to look at sort of the most common diagnoses, and people typically use it for upper respiratory tract infections, UTIs, eye and ear issues. And it's really exploded in the last 7 or 8 years. The pandemic facilitated the explosion even more. But it's a very particular type of platform. And whether or not it's really comparable to outpatient care is debatable. I think about direct-to-consumer telemedicine kind of like an Uber. Patients, they call, they go online to get this care and they expect to get, a certain kind of outcome at the end of it because they're paying a fee for it. And they don't have a relationship with their physician. They've never met this physician before. The physician doesn't have access to any of their charts or anything like that. So it's much more transactional. So yeah, it's a very specific type of care.
Awesome. And so what exactly were the findings of your study then?
So there are a lot of findings. I was just going through it again. So we were looking at a lot of things. So the first thing we were looking at, we kind of triangulated, visit length, prescription receipt, satisfaction with care, and gender. And we were looking both at patient gender and physician gender. The most important thing that we found was that female physicians did indeed have much longer visits than male physicians. And if direct-to-consumer telemedicine, this is important because physicians are paid in volume. So the physicians on DTC telemedicine are paid via the number of patients they see in a day. So even though it seems like it was only about a minute difference between male and female physicians, but that will compound over time. And female physicians will be able to see fewer patients than male physicians, which does have implications for their compensation. The other thing, and this is maybe better news for female physicians, is that patients like them a lot more than male physicians. Everybody liked the female physicians more than the male physicians. So that is encouraging. And one thing that we had tested here was, is it that because female physicians spend more time with patients, that patients give them higher satisfaction ratings? And we did not find that to be true. Irrespective of how long the female physicians spent with patients, the patients just like them more. So the implications of this, on the one hand, are female physicians could shorten their visit length and they would not pay any price in terms of satisfaction. However, it's also not clear, and we sort of touch on this in the discussion, how much female physicians are really in charge of the length of their visits. It could be that patients just like to disclose more things to female physicians. They just feel more comfortable with them. And so therefore a female physician can't, artificially cut the visit shorter to generate more revenue for herself. So this was really just an exploratory study. I think it raised a lot of questions about gender dynamics within these encounters. Another interesting thing that we kind of found that we need to pursue further is that it does appear that there's some differences in prescription practices between male and female physicians, and this does appear to vary by the gender of the patient. And it's hard, you don't want to become too speculative, with your data, but we found that female physicians were less likely to prescribe to male patients. And, you kind of wonder, is this sort of the phenomenon of the female physician thinking it's the man flu or whatever, that they don't want to treat them as much. But again, these are just all things that the study raised as questions that we'd like to pursue further. It just happened to be that we had a really great data set to explore these questions in. But what the data has in breadth, it lacks in depth, right? So it's really administrative data. So we don't have any of the history of the patient, or really anything clinically other than what the physician ultimately diagnosed them with.
Wow, well, that's fascinating. So, what do you foresee as the implications of this study into the foreseeable future, I guess? And do you think there need to be any changes made to the system in regards to how female physicians are compensated?
I think there's a lot of really important work coming out right now about sort of the differences in work burden with respect to time that female physicians are experiencing. And there's work done by Lisa Rotenstein and other people at Harvard, really looking at the amount of time female physicians spend on documentation in the EHR. And then, we and others have found they're spending more time with patients as well. In terms of system changes, there are a number of problems with satisfaction as a metric, right? So I'm reticent to say giving female physicians a compensation boost based on their satisfaction measures could, tip the scales back in their favor, because patients are often satisfied with pretty bad care because patients don't really know what they need. They just like to get things like antibiotics. I think that what's really probably the best thing to do right now is to keep generating really important research around gender differences. Also, I think looking at gender differences across the age spectrum of physicians. So really looking to see the burden of time spent on documentation and with patients for female physicians, say in midlife, that are dealing with childcare duties, that are dealing with caring for aging parents, because there is an epidemic of physician burnout in this country. It's just going to keep getting worse for female physicians if they are spending more time on everything than male physicians.
Absolutely. Well, this is a great study with a lot of implications for our physicians nationwide. So, Dr. Martinez, what work do you have planned for the future?
Well, this is not my day job, right? So I don't normally do work on telemedicine, gender differences. We are starting to do some work looking at how to reduce inappropriate antibiotic prescribing in telemedicine, particularly in the sort of direct-to-consumer landscape. Most of my work is actually in risk-based decision-making by physicians. So I'm doing work to see how we can improve risk-based prescriptions of statins and prescription of anticoagulation for patients with AFib. But this is definitely going to be a hobby of mine. My side projects will remain in telemedicine. There's a lot of really interesting new questions coming out with different direct-to-consumer telemedicine platforms, and you may be aware of things like hers and his that specifically market to particular genders and offer things like beta blockers and anti-anxiety medication or erectile dysfunction medication that is really a lifestyle medication website, but really even more so like an Uber, that you are really only going online because you want to get prescribed a particular thing. So I think there's going to be a lot of interesting research coming out in the future around what this is doing to help the healthcare system, and then also how it influences patient expectations of care when they go to their normal doctor. If you can just circumvent your normal PCP and get a beta blocker from the internet. So how does that affect decision making?
Wow, well, I'm looking forward to seeing some of this research. Well, thank you so much, Dr. Martinez. It was a pleasure to speak with you.
Yes, nice to talk to you.